Well, they say breastfeeding saves the lives of infants and also reduces their disease burden. And it's very important that the mothers out there, embrace this aspect of breastfeeding. You're told at least 6 months exclusive. On numerous occasions, I know we have said, 6 months is a little bit too much. And your oldies, your mommy would tell you, just throw in some porridge, throw in some water, throw in some milk and all that. But the specialist will tell you 100% exclusive breastfeeding is what is recommended. Just what will it take us to get to this point where we accept this, and just how important is this art of breastfeeding, as I have said, very important in making sure that the lives of the infants then are protected. And so we get into this conversation as we stare at the worldwide week of breastfeeding, a very, very important conversation as we get to make sure that the mother and the baby then are allowed this chance to bond. Most importantly, the mothers are enlightened on what they need to do to make sure that they give their babies the best of milk. And so as we get to this conversation, we welcome it. We'll keep it open for you to be part and parcel of it. Interact with us. Tell us what you make of the very same conversation. Share your experiences. It's all about fun. And I'm sure the mothers out there will tell you the difficulties that come along with that. And the beauty of it all is that the men are not being left behind. They also are joining in this conversation. Long time ago, it was a different affair where it was about the mothers, and when you give birth, your husband steps aside, and you are taken to the mother-in-law, you are taken to your mother, and you're told that these are the ones that are going to walk you through this journey. But no, the men are saying that we're not going to be left behind. We will be part and parcel of this life of our mothers as well as our children. And so Irene Nyaucho, who's program officer, Nutrition World Vision, is joining us this conversation, this morning for this very conversation, as well as Alphonse Mwema, clinical nutritionist, Kenyatta National Hospital, and a lady from the NMS bit of Dagoretti, that is Nutritional NMS Dagoretti sub-county? It is sub-county, yes. Susan Kagia is also joining us for this. And well, I know there's so much to discuss about this, but I would want to believe that we are going to make it as simple as possible for the people that are watching us this morning, and therefore allow us to get into the conversation by first of all starting to just get to understand the importance of breastfeeding, and especially the importance of these days that are out there to speak about it, to remind the mothers of making sure that they get to breastfeed their children exclusively, for that matter. Perhaps to start with you, Susan.
Okay, thank you and welcome viewers. Today we are going to discuss about breastfeeding, the importance of breastfeeding, especially for the mother, and looking at the benefits all the way, because we have the benefits for the mother, for the baby, for the family, all the way to the community and society at large. So we'll be looking at why do these mothers really need to breastfeed? And Rinda, you have said breastfeeding for 6 months exclusively look like it's just too much. But for sure it could be too much, but it's adequate, it is enough. And what do mothers need? They need support for them to be able to breastfeed for 6 months without giving anything else. So we'll be looking at what are these benefits. How does it benefit this baby? Because why mother feels that it's too much for them, it is probably because they don't know why are they doing it. So let's start by just saying, why is it very important for this baby to breastfeed?
Wow. That's true. Yes. And Alphonse, we come to you as a clinical nutritionist. Perhaps you are on constant communication and also constant moments with the mothers out there. At this very stage, they have to prepare themselves, I'm told, prior and even to that moment after they've given birth, to just getting to understand what it takes to make sure that you get the right foods that will give you enough milk, milk that is rich in all the nutrients for the babies. The difficulties that come along with accepting the 6 months, exclusive breastfeeding is one thing that we still gamble with today. Just how are the ladies and how are the mothers out there embracing this?
Well, thank you for having me. I think when it comes to breastfeeding from a clinical setup, the most important thing, we want to make sure that the mother goes home with a healthy baby who has no issues. So we want to our focus is to help this mother who has delivered, because most of the time, some of them present with challenges that face breastfeeding, and they are not able to breastfeed their baby. For example, they do not have enough breast milk, and some do not have even, they are producing zero breast milk. So from clinical setup, how do you help that mother to make sure by the time they are leaving the hospital, they go home with a healthy baby, and when they start follow-up now from the Well Baby Clinic, they continue without coming back to the wards with issues here.
Sometimes they leave the hospital as soon as the next day. And therefore, is this enough time for them to have proper understanding? And does it then speak hugely of why it is important for them to go for clinics even before the D-Day?
Yes, that is very correct. For mothers who have delivered normal or what we call spontaneous delivery, they are discharged the following day. But the care process starts long before they come to deliver.
Okay.
It starts from the antenatal clinic. That is where they start getting the knowledge, the information from our caregivers, the nutritionists, the nurses, and the doctors. They are educated from the time they get pregnant all the way to the time they deliver. So after delivery, they already have that knowledge. What we do after delivery, we emphasize on that same knowledge, so that we make sure the knowledge is very clear to them, and they clearly have the knowledge before they go home.
Well, it's quite a challenge, and I'll tell you that as a global fraternity, there's been so much efforts to us addressing this question of breastfeeding. Child malnutrition cases are high, child mortality cases are on the rise, but then again, so much efforts are being put on board. I have seen instances where, because of the difficulties of breastfeeding, then children are put to, say, substitutes, and they're given nutritional supplements that would come in handy to make sure that they stay alive even as the mother struggles to get to breastfeed them. Just how then does an entity like World Vision come in such a scenario where this can be put to rest, because it affects very many, especially in the sub-Saharan Africa?
Thank you very much for having me. And as the non-governmental organization actors, we ensure that we are supporting the government in spreading this news and informing the communities, and ensuring that they are resilient enough to be able to breastfeed. Yeah. There are interventions that have been put in place at community level that ensures behavior change. As my colleague said, the hospitals have their interventions at hospital level. So as organizations, we ensure that these mothers, once they get out of hospital, they have a good environment at the community level to be able to continue to breastfeed. And they have support from different actors at communities. They are influencers. We have grandmothers, we have fathers, and other people at the community, like community leaders, to be able to support them continue to breastfeed. Right. And this will make it easier for the mothers.
All right.
Yeah.
Okay, I like that very point, and I think I come back to Susan. Susan, you're right at the heart of the community. When we're talking about Goreti, then you're interacting with very many mothers out there. And I'll tell you, it's a whole different generation, that this conversation of exclusive breastfeeding is just getting itself into the system. And, say our mothers back then never used to do that. Perhaps 1 month and the baby is being fed ugali, literally. And their kids used to do so well. And so that's the reason why you'll find these oldies and these ones that we're talking about, support groups in society, would fight with this. What efforts are being put towards making sure that the entire society then is enlightened on this new system of exclusive breastfeeding, to a point where they embrace the same, they understand the benefits, such that when a mother comes home, then they get the kind of support that they require to exclusively breastfeed?
Thank you. Well, there are programs that have been put in place at the community level. And I want to start with saying that it is not only at the community level, because we link these programs to the facility. So as we speak about continuum of care for this pregnant woman, and thinking all the way until when the baby will be 2 years. So we are focusing at 1,000 days for this child. So we start this care at the facility level. So the facility level that we call level 3, facility level, also at level 2 facility level. So we are thinking about dispensary and health center.
Yeah.
So healthcare workers start supporting this pregnant woman. When she get pregnant, start coming to the facility. So we start supporting them, educating them on importance of breastfeeding, and also giving them skill on how to do it, because it's not necessary that they know how to do it. Then after delivery, then there is the continuum of care to the community. So what are we doing at the community? We have formed like support groups at the community, whereby we have mentor mothers who are doing very well in breastfeeding, and they take lead in those support groups. The other thing we are doing, we are using community health volunteers within the community, so we invest in educating them matters, maternal, infant and young child nutrition. So when we educate them, then we set them out to the community, because they live with them together. And so they keep on educating them using the approach of house-to-house visitation. So they are visiting the family members and educating them, and not only the mother who is breastfeeding or who has a young baby, but also looking around other family members. We are thinking about the spouse, the father. We are thinking about that mother that you are saying they used just to start giving food as early as 2 months. So we really need to inform them and tell them what are these benefits of breastfeeding, so that we can change their thinking, and they can help us also to help this young generation.
Wow.
So that's the approach that we are using right now. We call it Baby Friendly Community Initiative, which is working in our communities, and we are trying to scale up to every community.
Okay. Prenatal, antenatal, all these cares that, you know, a woman would go through at this point of, you know, conception, or this point of, you know, siring, and most importantly, giving birth to these babies. Alphonse, in most cases, we see mothers a little bit reluctant, you know, in following the clinic processes that are very, very important prior, during, you know, pregnancy, and even after pregnancy, after giving birth and all that. Just how instrumental is this, and what goes into, you know, the conversations that play about in the event that they go to the clinics, in the event that they go to the health facilities, to a point where, you know, you would be confident that these mothers are wired differently, but then we are happy that we have managed to take care of this one that is having difficulties with breastfeeding, to a point where we can say now the baby is perhaps getting something.
Well, if I got your question correct, it is very important for those mothers, starting from when they are expectant, to attend antenatal clinics, because it is during that time when they are pregnant when we are able to correct some of the difficulties or deficiencies that will present when the baby is born. It is inherited, the deficiencies, some of them are inherited from the mother, and they are passed on to the baby when they are born. So we try to emphasize and try to show them the importance of attending antenatal clinics early enough, so that the things that can be corrected, especially the micronutrient deficiencies, are corrected early enough, because some of them affect the baby in such a way that the brain development of the baby, the outcome, the baby that you get after you give birth, has brain development issues. And those are simple things that can be easily corrected by supplementation of the mothers when they come for antenatal clinics. So we try to correct that. We try to tell them the importance of doing that. We show them the other side of not doing that. And by so doing, we find that most of them accept, and they come for the clinics without fail. When they come to deliver, we still emphasize on the importance of follow-up after delivery, because these are newborn, and newborns sometimes when they come to this environment, these are new environment they are not used to. We have so many diseases and germs all over, so we try to help them to see the importance of follow-up after delivery. Even if you are discharged with a very healthy baby, you still need to be followed up at the postnatal clinic, at the well baby clinic.
In this advanced world, why do we still have cases of malnutrition, and especially for infants that are pretty much young, still below 6 months, as well as are there scenarios where you would advise a mother not to breastfeed at all?
Well, we still get a lot of malnutrition in especially under 5, and more so under 6 babies under 6 months. And this most of the time happens because the mother may be not producing enough breast milk, and they may not be aware that I'm not producing enough breast milk. To them, when the baby is breastfeeding, they are okay, but they are not aware that the milk is not enough for the baby. So with time, the baby develops malnutrition. So when we get these babies, we try to correct the malnutrition before we send them home again. And if you get a baby, of course, with malnutrition, a baby under 6 months, we still emphasize on exclusive breastfeeding to correct the malnutrition, because most of the time, once you start giving the baby enough of the nutrients, they start now gaining weight. The malnutrition starts correcting itself with time, without using anything else apart from breast milk. So we try to see what is it that is causing this mother not to produce enough breast milk. We correct that, and once the mother starts getting enough breast milk, then we are good to go. We start correcting the malnutrition now going forward.
All right, Irene, so with entities like World Vision, how then do they come in to literally and practically assist in this? And do you work in conjunction with other entities, say health facilities, or how then do you get to penetrate to these people that are in society that would require the necessary advice and maybe necessary boost to have proper aspects of breastfeeding?
Basically, World Vision works with government structures to ensure sustainability. And what we do also is to roll out, as Susan said, the baby-friendly community initiatives. Ensure that we are supporting the government to roll out these initiatives to communities. And when we are doing this, we work with the community health volunteers who are at community level. These are people who are chosen by the community to be able to give support to their counterparts, to their community. So we do train them on maternal, infant and young child nutrition. And after that training, then we support them at community level to be able to go out and do counseling for mothers, do follow-ups at household levels to make sure that when a pregnant mother is in the community, this mother is able to attend the antenatal clinics. This mother is able to feed the child on breast milk exclusively for these 6 months. So the community health volunteers go to households every month, at least once, to ensure that this mother follows up the advice given by the medical practitioner at the health facility level. We also empower these community health volunteers to form mother-to-mother support groups at community level. What is the role of these mother-to-mother support groups? It is to give the support to this mother who is pregnant and who has given birth, to be able to continue breastfeeding by encouraging and sharing best practices from other mothers that have practiced. We know that there are so many mothers who have practiced exclusive breastfeeding and they have their own stories to tell. So during these mother support groups is when the mothers share on what were the experiences, what were the challenges, and how would they be able to support each other better, and what would they need from other actors of the community. And also in baby-friendly community initiatives, we have the community leaders who we sensitize on baby-friendly community initiatives. These community leaders are the ones that we use to help us to demystify the myths and misconceptions of breastfeeding at community level. We acknowledge that we are diverse and our cultures are different, and we have different beliefs. And do these beliefs hold water during childcare? And which are the best things that the child can get? So these leaders help us to support community members to be able to understand the advantages of breastfeeding and how these myths and misconceptions can be addressed at household level.
All right. Well, Susan, so on that very note, it's obviously a good initiative, but then I'm sure there are difficulties that come along with that, and perhaps some of these people at that level would share and they would say, this is what I'm going through, and I mean with the wisdom that lies therein, and those ones that you're working with, then they could be advised accordingly. So what kind of support of breastfeeding is necessary, especially during delivery, and how do you get to note those ones that would require this help at that community level once they come out of hospital? How do you identify them? How do you get to entice them to join in some of these groups, baby friendly initiatives that would help them through?
Thank you. So at delivery, the support that we give is that when the mother comes for delivery, we want to support the baby come out and start what we call re-initiation. So re-initiation is whereby we start breastfeeding the baby immediately after delivery.
Okay.
So we also encourage skin-to-skin contact. So when the baby comes out, it's placed on the mother's tummy. And this information, we start giving it to the mother during the ANC clinics or during antenatal visit. Tell them the importance of having the baby put on the tummy or the chest immediately after the delivery. And the healthcare worker or the midwife will support the mother to do that. When they do this, there's a bit of baby getting the warmth, baby getting close to the mother, baby getting the immunity, and so many other things. And most of it, above all, the baby start breastfeeding. So they start breastfeeding immediately. You'll be shocked that you don't have to give the baby the breast. The baby will look out and figure out how do I get this breast, as long as they are put on the tummy. And it's very encouraging even for the baby to start stimulating those reflexes.
For instance, there's this attempt to stimulate, but then again, still this mother is not able to get the milk. There are instances where there are mothers who still have small mammary glands, and therefore they could experience some of these difficulties. At this point, can you give the baby something else that would keep them going until you get it right?
Oh, we wouldn't say that the mother cannot produce adequate milk because the mammary glands are small.
I'm trying to imagine the difficulties of perhaps getting them there to be comfortable.
Yes, the production of milk, it's about hormones. And if a mother can carry the pregnancy, the hormones are there. So what we need to do, and the reason why we are putting the baby on the tummy, is to stimulate these hormones so that milk production can start. So if you don't put the baby on the tummy, if you delay attaching the baby to the breast, or baby delays being breastfed, then of course milk will not come. It may not come because the hormones have not been stimulated. So that is one of the difficulty, that the mother may say, I do not have milk, yet she can have milk. So what do we need to demystify? That almost all mothers are able to breastfeed and produce breast milk. So what do we need to do? The doing now comes in that immediately after delivery, place the baby on the chest. Allow the baby to be with the mother at least 1 hour together without interruption. And then within that period, the baby will start doing what? Will start breastfeeding. Just to let you know, Linda, that this baby, they have very small tummy, very small tummy.
Also, they just
2-3 drops.
Enough. Yeah, okay.
2-3 drops, they are enough, adequate for that meal. And then again, we are also encouraging breastfeeding on demand.
Okay.
So anytime the baby feels that, oh, I'm hungry, or anytime the mother feels, oh, you have slept so much, you need to wake up and breastfeed, and just put the baby on breast, that's little drops are quite adequate.
Okay.
So we need to address this not enough milk, because it is actually most of the time in quote, because we are saying almost all mothers are able to produce this milk. But what do we need to do to support the mother? Place the baby on the breast. Make sure that they have positioned the baby well. Make sure that the baby has attached to the breast very well. Then when this happens, then the mother is psychologically motivated and encouraged. Then of course the milk will start coming.
All right, and Alphonse, nutrition is very important in this case, I would want to assume, because you are told, can you take porridge, can you take milk, can you have the fruits, can you take, all this, say beans, or so to speak, the grains, that they would help you stimulate, that they would help you get enough milk. Can you do soups all right and center? Just how important is this conversation of nutrition, and how do you get it right so that you get enough milk and rich milk for that matter?
Well, it's very important for the mother to get enough breast milk for the baby after delivery. So nutritionally, you need to make sure if the mother has delivered a normal delivery, they are supposed to start eating immediately. We encourage them to take especially drinks, nutritious drinks. We encourage them to take soup. We encourage them to take porridge. We encourage them to take other drinks like Coke or chocolate. It is very important for the mother to, breast milk is 70%, 80% water. And the mother needs a lot of fluids to make enough breast milk. So we encourage them to take a lot of fluids. What we cannot provide in the facility, we encourage them to get it from home when the visitors come. And if for whatever reason we are not able, the mother is not able to eat or to drink anything because of medical reasons, then there is a way of now taking care of that baby until the mother is able now to start feeding and producing breast milk.
And so once the mother is able, then you stop with these other foods and focus now on breastfeeding?
Once the mother is able to produce breast milk, whatever you are using to feed the baby, you stop and transit now to breast milk.
How long should one breastfeed their baby? Because there are instances where mothers say, you know what, we do not want the glands sagging, and therefore at around 6, 7, 8 months, then we can literally stop the baby. You put pili there so they do not get it. Is that wrong in any way?
It is wrong.
That is very wrong.
It is not right. Number one, putting pili.
What's the maximum age that we should say now? This can be now.
When we talk about optimal breastfeeding,
yes,
we are talking about exclusive breastfeeding for 6 months. This period, we are not giving anything to the baby, except maybe when they are sick and they have been prescribed for some drugs or medicine. This is that is only time we can give medicine. But for the first 6 months, we expect that baby should get only breast milk. Then after that, there is that introduction of complementary feed and continuation of breastfeeding for 2 years or beyond. A mother can go up to 4 years if they want, but at least for 2 years. This is what we would call now optimal breastfeeding. The issue of breast sagging. there are stories, but it happens.
Yeah.
Yes, it happens not because of breastfeeding, but because of aging.
Okay.
As
it comes with age
my dear
automatically.
friend, with or
You
without
cannot
a
be as
baby.
rosy. So how well is the world, so to speak, how well are the people out there in communities receiving these initiatives that are being presented by the likes of World Vision to embrace, to join in, to learn some more so that they can enlighten others as we continue?
Now, we have an advantage of those who have practiced. We recognize that. And now, the role of the community now is to spread the news, like what is the experience, how I breastfed my child. And then now when we come to the community misconceptions, like the one you have spoken about, you then weigh between having these benefits or that misconception. For example, when a mother breastfeeds, a mother lowers her risk of getting cancer, breast cancer. So then a mother will weigh the benefits and the misconception. So as World Vision, we ensure that mothers are getting this information through now the structures that I had mentioned earlier, and ensuring that there is information even on the media. We sometimes use the local media to be able to give this information to communities and to be able to open that forums for those discussions. For example, the community leaders like the chief can be able to influence whole lot. The church leaders, they can be able to influence whole lot. So when these congregations, for example, at community level, the chief has the community dialogues, the chief barazas. What is being discussed in that chief baraza? Then we give this space and encourage the chief to discuss breastfeeding and how this breastfeeding will ensure a healthy community in the future.
Okay.
Yes.
All right, amazing. And time is moving very fast. I'm told that we're supposed to be out of this place. But not before I get your parting shots, especially at this point when, it'll be a whole month of acknowledging, celebrating, and creating awareness of the importance of breastfeeding. What would be your parting shots? What would be your clarion call? What is the call to action to the communities out there, to the mothers, and generally everybody in society towards making sure that this is a success?
Yes, this month as we celebrate the World Breastfeeding Week, we want to call all mothers to practice exclusive breastfeeding, giving their babies breast milk only for the first 6 months, and not forget to continue breastfeeding for 2 years or be old. But we also want to call the healthcare workers to support these mothers to breastfeed, educate them, because some of them, they give up on breastfeeding because they do not have adequate information on importance of breastfeeding, and then they lack skills on how to breastfeed. So we need the healthcare workers to come out and support these mothers, educate them, support them, give them skill, work with them all the way from ANC during pregnancy, all the way until the baby gets to 2 years.
All right. Well, thank you so much, Susan. And Alphonse Mwema, very important that we leave people with something that would be more of, call to action. So what would you tell them as we celebrate and commemorate these important days of making sure that we have proper awareness as to breastfeeding?
Well, I would like to say this. All breastfeeding mothers and all antenatal mothers who are expectant, they need to be aware of the importance of nutrition during that period. They need to be aware of how proper nutrition will benefit the baby and how poor nutrition will affect the baby in future. So I'd like to encourage all the healthcare providers, wherever they are. From our point, we are referral hospital. We get patients from all over. These patients are handled by other people, other healthcare workers from the community level, level 4, level 5. So I'd like to encourage my fellow colleagues in those levels that we try our best to give this information to the mother early enough so that we may, when the mother delivers, we get a baby who is healthy, who will not again become a burden to our healthcare system. Yeah.
Irene, as we all acknowledge that we have made great gains, there is also so much that needs to be done. Your clarion call to the people.
For me, I would like to call on even other actors to be able to support breastfeeding at their own level. For example, the youth. The youth will be able to support breastfeeding in their own way by spreading the good breastfeeding messages through social media, and also being able to support a mother, for example, one breastfeeding in public and not shaming them in public. And other actors also, like the other non-governmental organizations, to be able to support the capacities of health workers, community health volunteers, and also the other careers. Like now for the gynecologists, they have an important role of encouraging mothers to breastfeed. The pediatricians,
Right.
they have an important role, because whatever a pediatrician tells a mother goes. So if breastfeeding is encouraged at that point, then the mothers will be confident to breastfeed. So for me, I would like to ensure that the mothers have confidence to breastfeed, because confidence will help them breastfeed better and become good role models to other mothers who are younger. Thank you.
All right, I remember this lady who went to Parliament with a baby and was breastfeeding from there. And while we all expected that she would get some backlash, on the contrary, she was appreciated, and therefore we acknowledge and appreciate these days that create that aspect of awareness, and also the contributors in different dockets of society.